Hello and welcome to Health 2020. I'm Dr. Salom Daoum. Did you know that cervical cancer is preventable? Yet it remains the second most common cancer affecting women in this country. It is also treatable and curable, and no woman should die from it. But it is one of the main causes of death for women in South Africa, with almost 3,000 dying from it every year. So today we discuss cervical cancer to understand just how many lives could be saved through prevention in young girls and regular screening in older women. I'm joined by a colleague who's an expert in gynecological cancer, but before that, we share stories of two women with you.
Ke ne ke sa itse gore ke na le cancer. Ke tsamaile treatment ko tleliniking. Ko tleliniking ba re ha ba bone niks. So ka kopa letter gore ke bara. Ha ke fitla ko bara ka ya ko dizozo ko bara. So ko bara ba fitla ba check. Ba bona gore ke cancer. Ne ke sa itse gore ke cancer. So be ke re ba re monna ba re cancer ya gago e mo hungu. Ke re ke kopa lens. Ba re no ka se ra itse. Re tlo go romela ko Johannesburg jail. Ke ne ke utlwa botlhoko. Ne ke nagana ke a shwa akere. Akere cancer ga tlo ya go ya go. Ne ke utlwa botlhoko. Mara ba re monna ba re o ske wa bereka strainers, o ska kuka dilo tse heavy. O bereke fela ntho tse light. Ya go bo dikotlolo tlhatse. Ska tlhatse di wash. Ne ke tshogile gore cancer e ka mpolaya. Mama ka boleilwe ke yone ntho e ya ke mmolela ba tlhokofa. Ne go le botlhoko. Ne ke sa kgone go tsamaya. Ne ke bleed. Ne go tswa mahlwele.
I was diagnosed with cervical cancer in November 2015. It was a long process. For about a year prior, my gynecologist picked up abnormal cells, and then he would say, I'm picking up abnormal cells, come back in 6 months' time. And I went back and he said, I'm picking up abnormal cells again, but it's not a problem, come back, you'll be fine. And when I was diagnosed, he did a pap smear, and when he looked at my cervix, he said, your cervix looks terrible. And he sent me in for a biopsy, and I was diagnosed. I started feeling pain down sort of on the opposite side of your appendix. I started feeling pain, and it got so bad that sleeping on my left side was painful. But you're busy and life carries on and you're running a business and all of these things. And so I just kind of put it out of my mind, and getting an appointment with a gynecologist takes a little bit, takes a little while and everything. So there was something, and I knew that there was something, but I didn't really pay attention to it straight away. Treatment was really tough. So I couldn't have a hysterectomy because the cancer had spread outside of my cervix. And so I needed radiation and chemotherapy. I was very, very, very sick. I was nauseous. I threw up. I couldn't eat. Chemotherapy changes your taste buds, so everything tastes like chemicals, and even water. You can't even drink water, which you're supposed to do, but it's just really just horrible. I didn't eat. I lost a huge amount of weight, and I was just so exhausted, barely able to get out of bed. I didn't lose my hair because that's a different kind of chemo drug, but everything else.
Right, so Dr. Trudy Smith is an expert in gynecological cancers, or gyne-oncology as we call it. Now, she practices from Donald Gordon Medical Center and is also senior lecturer at Wits University. Dr. Smith, welcome to our program, and thank you so much for your time.
Thank you for having me.
All right, so the topic today is cervical cancer. Let's just start from the basics. Where is the cervix and what is the purpose of the cervix?
So the cervix is the mouth of the womb. It sits in the vagina. As we said, nobody likes to talk about it because we have to say the word vagina. But it's a very important little thing. If you feel, you can feel it at the top of your vagina. It's what keeps your baby in when you are pregnant. And it's what dilates and opens up and lets your baby out. It's a connection between the inside world and the outside world that we have.
All right, so then what is this cervical cancer? What actually goes wrong in the cervix?
So what happens is cervical cancer is when there's a growth on the mouth of the womb. And normally it's a nice smooth thing, but now there's a little knobbly in a growth, and that growth can continue to grow, and it can grow into the vagina, and it can grow into the front where the bladder is and to the back where the rectum is.
And I mean, talking about the cancer growing, the one question people might have is, oh, okay, so how will I know that I'm starting to have or I have this cancer? Are there any typical signs and symptoms, for instance?
So certainly in the early stages, at the beginning of cancer, you can have no signs. But one of the earliest or the commonest one is bleeding. Bleeding when it's not meant to be your period. So any woman who has stopped their periods, who is what we call menopausal, has never, they reach that time in their life, they should never bleed again. So if they bleed, they need to see somebody. And also if you bleed in between your periods or you bleed after intercourse, that is a common time when you think there might be something going wrong, as well as a discharge.
Yeah. So I mean, we spoke earlier about the fact that it remains one of the, commonest killers of women. I'd like to find out from you why is that the case and what actually happens, up to a point where somebody unfortunately dies.
I think the problem is because it's in the vagina and because it's the cervix, you don't always like to go. Nobody likes their vagina to be looked at, number one. Number two, often we know that from a study that we did that women went to go and see 5 practitioners with abnormal bleeding and nobody examined them. So if you have abnormal bleeding, I would say please insist on being examined inside your vagina so that we can look at the cervix for the growth.
Yeah.
So those are the issues that we have. Is it's not that women present late, it's often because they're afraid to go or because their practitioners are not checking.
Right. So the other very important related question is the cause. And perhaps let's start by looking at who's at risk of developing, cervical cancer.
So we're all at risk of developing cervical cancer. So it's caused, 100% of cases are caused by a virus called HPV, human papilloma virus.
Yeah.
You can't avoid HPV.
Yeah.
The only way to avoid it is to never put anything ever in your vagina.
Well, tell us a bit more about this virus, HPV. What is it?
So human papilloma virus, there are many, many kinds. And HPV likes certain parts of your body. For instance, a little wart on your arm is actually HPV. A wart down in the genital parts is HPV, but it's a different HPV that causes cervical cancer. So the specific ones that people talk about is HPV type 16 and 18. They cause 70% of cancers. And then there are a few other what we call high-risk HPVs.
So coming back to that question of risk, I mean, there's the whole question around genetics. If somebody might say, if my mother was diagnosed with cervical cancer, am I at risk of, developing cervical cancer later?
So we haven't as yet found a genetic link to cervical cancer. But because it's so common, you often see many women affected by the cervical cancer. So we don't think there's genetics, but there certainly are other things that put you at risk of your body not getting rid of the HPV, like smoking, for instance, is very bad for HPV. It's quite interesting because smoking paralyzes the special cells that get rid of HPV. And for instance, if you were HIV, your risk is higher because you're unable to fight that infection.
Yeah, I think that's important. And anyway, having understood the causes and that one very big cause, it'll make sense for us to talk about prevention later on. But that we're going to do after a break. We're going to take a quick break. After the break, we'll learn more about prevention, screening, and treatment. and of course answer some of your pressing questions. But Lauren Pretorius is passionate about raising awareness of cervical cancer. This is what she had to say.
HPV is a sexually transmitted virus, and it is the cause of over 85% of cervical cancer cases. But cervical cancer is a slow-growing cancer in the beginning, and often we can tell through the tests that the cells will become cancer. So when you go for your test, they're looking for the cells that might become cancer, and that's why we must have the tests early and regularly. Because if they can find those cells, they can treat those cells that they don't become cancer, and then you're saving your life. If they do become cancer, those cells then will grow and multiply. And then you will have to look at treatment. And the treatment for cervical cancer is hard. And you can land up not being able to have babies. You can land up having part of your womb removed. So it's important that you start in the beginning when those cells are still thinking about whether they should be cancer cells, to go for tests and make sure that you know the symptoms. Your silence will turn cervical cancer into a killer.
Your silence and inaction can turn cervical cancer into a killer. We're going to understand how from our guest, Dr. Smith. And we're going to start talking about prevention. But before we enter into our discussion, let's see if we have some questions from our viewers that we received over the last week. The first one is from Stella, who says, I'm HIV positive. Does this mean that I'll get cervical cancer? And the other one is from Raylene Fenter, who says, what can I do to lower my risk of getting cervical cancer? Dr. Smith, perhaps you might want us to talk about these two first before we start talking about the concept of prevention.
So, important question. So the HIV story is that not because you have HIV, it does not mean you will get cervical cancer. What it does is it puts you at higher risk of getting cervical cancer because you are unable to fight that HPV infection. So your screening needs to be more frequent than somebody who is HIV negative.
Right. Talk about that one virus. Perhaps it's an opportune time for us to bring in the subject of the current pandemic, coronavirus.
Sure.
Is there any link between COVID-19 and cervical cancer?
So there's no link between COVID-19 causing cervical cancer or, in other words, helping you get the HPV. That's not true. What COVID-19 might do is stop you from going for your routine screening or stop you from going for your treatment of cervical cancer or prevention of cervical cancer.
Right, which is what we don't want to do.
We don't want.
And we're going to stick on that prevention one, but perhaps the other question was around how do I lower my risk of getting cervical cancer?
So you lower your risk, one, by going for screening.
Yeah.
Number two, by getting vaccinated, particularly vaccinating young girls as opposed to adults. But you can vaccinate adults as well.
Well, let's stick on that question of vaccination. We do know that there's a campaign currently, driven by government to vaccinate young girls. Firstly, just take us through the concept of this HPV vaccination.
So what the vaccine does is, so HPV is going to come in your vagina whether you like it or not, but it's whether it gets into the cell that is the problem. So you want to stop it from getting into the cells and causing problems.
Right.
So the vaccine blocks the HPV from getting into the cells. So you can vaccinate boys and girls, but when you're looking for bang for your buck in terms of economics, that's why we vaccinate girls, and that's why the normal vaccine program includes girls.
Yeah.
But certainly it doesn't stop you from vaccinating your sons.
Well, firstly, the ages of the girls now. What
Yes.
sort of ages are they targeting?
So you would vaccinate ideally before the age of 14, because if you vaccinate before 14, you only need 2 vaccines.
Right.
After the age of 14, you need 3 vaccines in order for it to be cost effective, you want to do before the ages of 14.
Right.
So generally between 12 and 14 is when you should vaccinate.
And how many such doses are required?
Only 2 doses.
2 doses.
Yeah.
All right. Talk about vaccine. I think we had another question from one of our viewers. From Mary Nkosi, who says, my daughter was vaccinated at school. I'd also like to be vaccinated. Is this advisable? A very interesting question.
Very interesting question. Yes, she can be vaccinated,
Right.
certainly, but cost effectiveness wants the daughter to be vaccinated. It is a relatively pricey vaccine,
Yeah.
but you can vaccinate adults up to the age of 56 for sure.
Whether or not they've been exposed before.
Whether or not they have been exposed before or not.
All right. Well, sticking to the adults now, let's talk about screening, because I think the message is pretty clear in terms of vaccination. Let's talk about screening. We hear about the pap smear.
Yes.
Let's talk about, that and other forms of screening for older women.
So what a pap smear is when you go to somebody and they look in the vagina and they take a scraping of the cells of the cervix, of the mouth of the womb, and then they look at that under the microscope. But we're trying to move to a new test, which is called HPV testing. So many women, and soon we will introduce that around the country, is you go and we just check for the HPV, because if you don't have the HPV, you can't have an abnormal pap smear. But if you have an HPV, particularly those 2 nasty ones we spoke about, 16 and 18, those are the ones that cause most of the cervical cancers. So if you have that, then we can do treatment to the cervix to prevent you from even getting a cancer.
All right. But we're not there yet. Or we're slowly trying to move.
We're transitioning, we definitely. So if you go to the clinic and they say, I'm doing an HPV test, it is the same as having a pap smear.
Right. And recommendations in terms of age, when people should be doing this?
So in the government sector, you can have a pap smear 30, 40, and 50. In the private sector, 3 to 5 yearly.
Yeah.
And if you are HIV positive, more frequently.
Right, right. I think we have another question that would like us to, help with. I'm pregnant. Should I go for screening? That's Lola and Lovo.
Very good question. It's not the ideal time to do screening. We would prefer you to come after your baby is born, because some changes in the cervix during pregnancy can make the pap smear difficult to read, and also for treatment. But if it is the only time you're ever going to go to the clinic, then it's not a bad time to go for screening.
Right, right. Just a little earlier, we spoke about, in the public sector to say from the age of 30 every 10 years.
Yes.
There's a concept of high-risk women, for instance, those with HIV and, other comorbidities and so on. Is the frequency of screening the same?
We would like our patients, particularly the HIV positive patients, to go every 5 years if possible.
Right.
The importance is not just to go for your test, but also get your test result.
Right.
So many women will go for the test, and unfortunately we don't have a perfect system, so the result can get lost. So it's important to go for your result as well. Make sure you get your result back.
All right. So we spent quite a bit of time obviously talking about, the importance of prevention and screening. But sometimes people unfortunately do get diagnosed with, cervical cancer and require treatment. Please can you just take us through the principles around treatment?
Sure. So if you have an abnormal pap smear, the treatment before the cancer comes is to either freeze the cervix or to cut a piece out of the cervix, or even to have a hysterectomy if that's quite radical, but it's possible. And that's to treat the pre-cancer. But once you get the cancer, it depends how far the cancer has spread.
Right.
If it is just on the mouth of the womb, we will do what's called a radical hysterectomy. So it's a big hysterectomy operation to remove the womb and the mouth of the womb. But if it's gone beyond the cervix, then we give radiation and chemotherapy.
In fact, when you spoke about, the result of the pap smear, we have one final question that we'd like to squeeze in. This is from Anonymous. Says, I've had a suspicious pap smear result. What do I need to do?
You need to seek help, definitely. So the suspicious pap smear can either be a minor suspicion, which we watch, or a major suspicion, or a high-grade lesion. In other words, we're highly suspicious. Then we would look at the mouth of the womb with a big microscope called a colposcopy, and then we would do treatment or biopsy the cervix.
However, the message for treatment is that this cancer is completely curable.
And preventable.
And preventable. Dr. Smith, thank you so much for your time and for the insight.
Pleasure.
All right, so time for a quick break. When we come back, we wrap up and summarize the most important for you today. Okay, welcome back, and here are these key messages that we all need to know about cervical cancer. Now, firstly, very important, cervical cancer is preventable by getting vaccinated, it is detectable through screening, and it is treatable if detected early. And screening for cervical cancer, well, as we said, for women at lower risk from the age of 30, we recommend that you do this once every 10 years, and if you're slightly higher risk, like for instance, if you're HIV positive, at least once every 3 to 5 years or so. What about screening during this pandemic? It's a definite yes. Please do not miss your appointments, particularly if you're at high risk or you've had a suspicious test. As you heard, please go back and get your result. What about treatment during the pandemic? Well, again, resounding yes. Do not miss your treatment for whatever reason. And of course, this includes your follow-up. And we continue to spread that simple message that will always be applicable. Please wear your mask when you're out in public, wash your hands regularly with soap or sanitizer, and of course, keep a social distance out there in public. Let us share these simple but very, very important messages with all the women that we know. Thank you very much for watching the show, and thank you for all the questions that we've received. And please continue sending your questions or comments via SMS, WhatsApp, Twitter, Instagram, or Facebook, as displayed on your screen right now. And until next week, it's a very goodbye from me, and please, please do take care.